It is March 17, 2026. We're streaming live from Deuk Spine Institute. Our patient is here with sacroiliac joint pain, SI joint pain, and lumbar facet joint pain, L5S1, bilateral. What that means is she has facet joint arthritis at L5S1. She's had a fusion at L4-5. You guys see that? Jordan will show you. There are screws and rods. We did not do her fusion. It was done outside by a different surgeon, a fusion happy surgeon. She developed sacroiliac joint pain. The surgeon identified the SI joint pain, and what did they do? They did another fusion of her SI joints. You can see 3 what are called screws on the left, and then 2 on the right. These screws go across the SI joint, and they attempt to fuse the SI joint. But guess what? She still has SI joint pain, so they didn't work, okay? So we're gonna go in with our Deuk plasma rhizotomy. We're gonna go in and destroy the pain nerves to the joint. That is the proper treatment. The Deuk plasma rhizotomy is the best treatment for sacroiliac joint pain. She had a very bad treatment, which is fusion with instrumentation. The literature clearly shows, the medical literature, studies are showing that SI joint fusions don't work. They don't work. And people are still getting them because the surgeons are recommending them. And surgeons are recommending them, well, because they make a lot of money doing SI joint fusions. SI joint fusions pay the surgeon and the surgical center a huge amount of money, like thousands of dollars. Deuk Spine doesn't do them because we know they don't work. That's why we don't do this procedure of fusion. Go ahead. All right, we're going to go ahead and treat the SI joint first, and then we'll go and treat the facet joint. We're going to start with the right SI joint. So go ahead and show the audience how sacroiliac joints become painful and how we treat them here at Deuk Spine.
Sacroiliac joint injury is a common cause of chronic back pain. The inflamed sacroiliac capsule tear generates pain signals. The best treatment for sacroiliac joint pain is the Deuk plasma rhizotomy. Sacroiliac joint pain nerves are destroyed. The advantages with the Deuk plasma rhizotomy is that it's an outpatient procedure that takes 30 minutes to complete, very minimal bleeding and pain after the surgery with immediate recovery and return to work the next day, as well as a 99% success rate and permanent pain relief with a single treatment. For more details, please visit our website at www.deukspine.com or call us at 1-800-FIX-MY-BACK, 349-6922.
The sacroiliac joint gets arthritis from an old injury. That arthritis causes inflammation and pain. The treatments that we do to date include pills, therapy, shots, fusion, and now Deuk plasma rhizotomy and RFA. None of those treatments work permanently except for the Deuk plasma rhizotomy, which is what we're doing right now. We've tried all the other treatments in our experience, fusions, RFAs, and again, nothing else has ever worked long-term for patients. So we offer them now this treatment called the Deuk plasma rhizotomy, which is where we basically go in and destroy pain nerves to the joint. That is what the goal of the RFA is, but the RFA is just not able to do it. Unfortunately, this lady has had a lot of surgery already. I can't go back and unwind the clock and take away the surgeries that were done. I wish I could, but we just have to do the best we can. There's a lot of scar tissue here. I can feel it. It's tremendous amount. It's from her SI joint fusion. It's just chewing up my probes. I think that's good. Let me have any questions from the audience?
No current questions at this time.
Well, since we're talking about back pain, she has two separate causes, right? She has the SI joint and she has the facets. Let's show the audience the 30 different causes of back pain that people get. I'm Dr. R. Deukmedjian with the Deuk Spine Institute, and we're going to discuss 30 causes of chronic back pain. Chronic back pain is back pain that lasts longer than 6 weeks, and there are 30 causes of chronic back pain. The most common cause is going to be a disc injury. Disc injuries such as disc herniations, disc bulges, disc ruptures, degenerative disc disease account for 86% of chronic debilitating back pain, and they are totally fixable with the proper treatment. The best treatment for disc injuries is Deuk laser disc repair. Let's take a look at the 5 lumbar discs that can be injured. The most common disc to be injured is L4-5, followed by L5-S1, then L3-4. The L1-2 and L2-3 discs are far less commonly affected. Next, we have facet joints. Facet joints are small joints located behind the discs in the back of the spine. There are 10 facet joints, each paired left and right, L1-2, L2-3, L3-4, L4-5, and L5-S1. The most common facet joints to cause chronic back pain are L4-5, followed by L5-S1, followed by L3-4, in that order. After the facet joints, which account for approximately 10% of chronic back pain, we move on to the sacroiliac joint. The sacroiliac joint accounts with the piriformis muscle for approximately 4% of chronic back pain. The sacroiliac joint is a joint located between the tailbone or sacrum and the iliac bone. There is a left and right sacroiliac joint. In this diagram, you can see the joints turning red, indicating inflammation and pain either in the left or right sacroiliac joint. These sacroiliac joint injuries and pain can be treated most effectively with the Deuk plasma rhizotomy of the SI joints offered at Deuk Spine or Deuk Joint Institute. The fourth most common cause of chronic back pain is a piriformis muscle injury. The piriformis muscle is located in the buttock, and there is a left and a right piriformis muscle. The muscle gets torn, unfortunately, when people bend the wrong way. This usually occurs in patients with orthopedic problems such as hip pain, knee pain, or back pain. By bending improperly, they put the muscle under too much stress and they tear the muscle. The torn piriformis muscle causes severe debilitating pain in the top of the buttock. There is a left and a right piriformis muscle, and this can be treated most effectively with the Deuk piriformis muscle release. This is performed percutaneously with a 4mm incision. The sciatic nerve does run through the piriformis muscle, and many patients with piriformis muscle syndrome also have sciatic pain down their legs, with pain, numbness, tingling, and weakness in the leg that's affected on the side of the piriformis muscle. Piriformis muscle can be treated with injections such as steroids, Botox, PRP, or stem cells. However, those injections always wear off and the patients end up coming back with the piriformis muscle pain that reoccurs. The most definitive treatment for permanent relief of piriformis syndrome is a piriformis muscle release. Next, injuries to the bones of the spine, touches the vertebral bodies. With trauma, can cause fractures of the vertebral body. Vertebral body fracture is diagnosed with X-rays or CAT scan or MRI, and they're treated with injection of cement into the vertebral body. Looking at the vertebral bodies, the most common to be affected is L1, followed by L2, then L3, L4, and L5. The sacrum can also be fractured. Finally, the coccyx is the last cause of chronic back pain. You can see in the diagram the red coccyx at the bottom. This comes usually from an injury where the patient falls on their bottom, sustains pain at the tailbone, and this can be treated with injections of the coccyx ligament. These are the 30 most common causes of chronic debilitating back pain, the most common being the disc, causing 85% of chronic back pain, followed by the facet joint, causing 10% of the chronic back pain, followed by the piriformis muscle and sacroiliac joint, which cause 4% of chronic back pain, totaling 99% of chronic back pain, which is totally fixable and curable with the right treatment. Thank you. I'm Dr. Deukmedjian. Thanks for joining us. All right, welcome back. You see from our video that there are 30 very specific causes of back pain that we're aware of today, and 99% of degenerative back pain can be categorized into one of these causes, 99.9%. One of those causes is the SI joint. Shot. There's also disc pain, which she does have a problem with her discs. I've talked to her about it. We're going to try this first and see how much relief she can get with this procedure, because it's far less invasive. Shot. But what I'm battling here is the scar tissue from her fusions, and there's a lot of it. That I can tell you, a lot. And not only scar tissue, but what we call bone. She has a lot of bone that formed around this area. Shot. From her surgery. And it's really getting in the way of me being able to treat her SI joint successfully. Shot. So we're doing our best. Shot. Sort of at the top here. Go ahead. Of what I can do. Let's see one more probe. All right, any questions?
At this moment, no current questions.
5 minutes. We have about 5 minutes left, folks. She's perfect for me. Her anesthetic is perfect. The problem is there's bone down here from the fusion because they put bone graft, and that bone is all over the place, so it's like blocking me from getting to where I want to go. Yeah, but I appreciate that. But the truth is I'm not worried about that part. I'm just trying to get as many of these pain nerves treated as I can, because I don't want her. I want her to have a good result. Oh man, not easy. I'm trying to get my tip to go where I want it to go. I just can't, because it's being forced away from where I want it to go by the existing scar tissue and bone. Shot. Oh yeah, no, she had allograft. I'm dealing with all the allograft. Mm-hmm. Yeah. so I'm going to go one more time just to see what else I can get down here. Shot. So the nerves, they run right along this bony surface here, right where I'm working. And hopefully that's it. All right, and now we got to get the facet on this left side, and we should be done. I mean, I feel like I did as good a job as I could. It's much better if people come before they get a fusion of the SI joint, because that fusion is going to cause a lot of problems. For me trying to get down, it blocks me from getting to where I need to go. Shot. What blocks me is scar tissue, calcification, bone graft, her own bone formation. Shot. As a result of the fusion. Shot. All right, so we're going to go in and treat the, go ahead, right there. We're going to treat the facet. Maybe one more here, Luis. Yep. Don't worry about that. I got that. Just get me another one. All right, any questions?
At this time, no current questions.
All right. So the blood loss for this treatment is about 5 cc's, which is 100 drops of blood. This is done outpatient. There is no hospitalization needed. Our patients go home generally within an hour of surgery. And we don't use any narcotic painkillers afterwards. We're not putting these patients on painkillers that you would need after traditional spine surgery. Again, I'm encountering that bone graft that we were talking about because of her fusion.
We have a question for you.
Sure.
Coming from Pavel on YouTube. Hi, Dr. Deuk. Can arthritis in disc and or facet joint cause pain going down the arm or leg? Thank you.
Yeah, arthritis of the disc or facet joint, either one, can cause pain going down the arm. Absolutely. We do see that quite a bit. It can do it through inflammation, and it can do it through stenosis. Stenosis puts pressure on the nerve. Inflammation irritates the nerve. The nerve we're talking about would be the nerve root. Shot. Just about done. Great question, by the way. Hopefully that's it. So to summarize, this patient, you guys can see she's had fusion done at 045 with instrumentation, not by me, but by another doctor. She's also had SI joint fusions on both sides, which we never recommend because they don't work. And clearly they did not work for her. Now, that said, you can see the scar from before, right here, from her lumbar fusion. You can see the scars from her SI fusion. We don't do these SI fusions because all they do is make the surgeon rich, the surgery center rich, but they don't work for patients. What works is the Deuk plasma rhizotomy. But today is a tough case because all the scar tissue I had to get through and bone graft that the other surgeons put in there around those bolts. So I hope it's going to work for her. We don't know until probably tomorrow. But I did as good as I could do given the circumstances. She also has 2 discs that are probably going to end up needing treatment in the future above and below her fusion. We call that adjacent segment disease. Very common with spinal fusion to have joints above and below the fusion become painful in time. And we have to treat them. So that's one of the downsides to fusion is adjacent segment disease. We don't get that with Deuk laser disc repair. Any other question?
No current questions.
All right, thanks for joining us. We'll be back shortly with another case. And good morning, Dr. Deukmedjian. It's July 17, 2024. I'm here with one of my Floridian patients from Punta Gorda. He just had his lower back fixed with 2 procedures, the Deuk laser disc repair for some bad discs and the Deuk plasma rhizotomy for facet joint pain, which we discovered when he showed up here and I examined him and found his facet joints were hurting him. You just had your surgery yesterday. You can see in the video, we went in and cleaned out 2 discs and got the pressure off the nerves. We also did the Deuk plasma rhizotomy on your facet joints and destroyed the pain nerves. How do you feel today?
I feel good. Yeah, I don't have any pain.
So the surgery helped?
Oh yes, surgery definitely helped. Yeah.
What was life like for you before the surgery? Why did you decide to have it?
I couldn't do anything. I couldn't walk. I still try to get around a little bit because I'm general contractor and I try to help my son out. I help the last, I'd say 6-8 months I've been in my chair and that's it. Watching TV and that's about it.
Because of the pain in the back?
Because of pain, and yeah.
And you've had a rough time because you had some fractures in your spine which had kyphoplasty cement put in, which looked good. And then the discs were the problem now, as well as your facet joints. And we were able to fix those yesterday.
Yes, I went to a different doctor over in Fort Myers who did the cement jobs. I thought that's all I needed. That's what one doctor said. Oh yeah, you just got these 4 fractures, I guess.
Yes.
Yeah, we'll fix that. You'll be fine. Well, it didn't do anything when he fixed that.
Well, and now you notice a difference.
Yes, definitely.
And you're not on any new pain medication that we gave you.
What? I haven't taken any pain medicine.
No pain medicine.
No.
And you're still feeling like the pain is gone. So yeah, I believe it worked well.
Yes.
Anything you want to say to your friends or family out there?
No, I'd definitely recommend Dr. Deuk for someone who has a back problem. Certainly, this disc laser surgery, I guess, he's the only one that does it. Seems to be the best way to do it. Like I say, I would recommend it. And a matter of fact, I have a cousin that has been having problems for quite a while. And when he gets back down here, he's coming back to Florida. I'm going to have him call Dr. Deuk, see if he can set up something.
Yeah, we'll take care of him. Don't worry. What's his name?
Kent LeDuc.
We'll look for Kent LeDuc. All right, sir. Well, enjoy life. Get those muscles back in shape. If you need anything, you call me. You have my cell phone.
Well, thank you very much.
You're welcome.
Yep,
You're welcome. Thank you.